To scan the plantar fascia, we're going to do this in two planes, a longitudinal plane and a transverse. The patient is positioned in a prone position with the foot a little bit outside the table. I'm going to place my knee against her forefoot so that there will be a relative dorsiflexion in the ankle joint. Placing the scanner at the level of the origin of the plantar fascia, we can see this anatomy. So we can see the calcaneal bone right here. We're going to observe whether the bone is regular, so not irregular, and that it does not have any pointy edges. We're going to observe also the plantar fascia. The plantar fascia can be seen right here and observe the thickness of the plantar fascia, but also the echogenicity. Also observe that this line is relatively a flat line and that it is not too convex, because that would maybe indicate also that it would be pathological. Overlying, we can see the heel fat pad and the skin, and underneath the plantar fascia we can see the flexor muscles. So the plantar fascia has a certain width, so I'm going to scan from medial to lateral in order to see every aspect of this plantar fascia. After I've checked it in longitudinal plane, I'm going to rotate the transducer to a transverse plane, observe the width of the plantar fascia. So here we can see once again the calcaneal bone with on top of it the hyperechoic fibers of this plantar fascia. And then from here on we are going to slide with the transducer to distal until you see that the bone is disappearing, and now we can observe the plantar fascia right here with its thickness. Observe again the thickness at every aspect in its width, but also the echogenicity and of course also the regularity of the bone.